Back in January, a group of health professionals pushed to update the definition of obese, and they recommended including factors like weight to or waist to hip ratio in addition to body mass index or BMI. And now a new study finds that under that definition, nearly 70% of U.S. adults would be considered obese. One of the authors of that study, Dr. Lindsay Fourman, says expanding the definition here could encourage people to address unhealthy behaviors, even if they have an average body mass index. And Dr. Lindsay Fourman joins us now. She's also an endocrinologist and an associate director in the metabolism unit over at Massachusetts General Hospital. Dr. Fourman, thank you very much for being here with us. I mean, this is really, eye-popping to hear nearly 70% of adults fall under this. How would this help those who are affected by this?
Yeah, thank you so much for having me talking about this really important topic. The obesity definition, we're trying to capture people who are at increased risk of health complications related to excess fat. And traditionally, we've relied on BMI alone, which is basically weight relative to height. But that can be very inaccurate. It doesn't necessarily capture people's body composition or fat distribution. Someone that's very muscular can have a high BMI, but not necessarily have excess fat. And conversely, someone who can be thin can have a lot of excess fat in their abdomen and be kind of inappropriately considered healthy. And so with this new classification, that's taking into consideration anthropometric measurements, things like waist circumference, waist to hip ratio, waist to height ratio, and trying to get at not only people that have a high BMI, but also people that could have a normal BMI, but have increased abdominal fat. And what we've termed, and we've taken the guideline and termed this anthropometric only obesity. And so we looked at in our study, understanding not only the change in prevalence, but also the fact that whether this anthropometric only obesity is an appropriate classification. And we've shown that people with anthropometric only obesity do have increased health risks. So they do have over time an increased risk of developing diabetes, cardiovascular disease, mortality. And furthermore, they also have an increased risk of obesity-related complications like hypertension, sleep apnea. And so now that we've had this anthropometric only obesity definition, this can really help people be appropriately classified and allow them to receive the appropriate help. And so potentially intensifying their lifestyle interventions, improving their diet, increasing physical activity. Also, their physician can more closely monitor for complications of obesity, such as hypertension, sleep apnea, diabetes. And so really treating them appropriately rather than sort of dismissing that they have a normal BMI and therefore don't have health risks.
Sure. Steps toward being healthier overall. Dr. Lindsay Fourman, thank you very much.